Hey, Dave Belfler here from Belfler Physiotherapy, and I'm with
Arifa.
Yeah, so one of the other physiotherapists. So occasionally, some of us we do need a little bit of TLC ourselves. Physiotherapy, manual therapy in particular, can be hard on the body. So Arifa's been developing some lateral epicondylitis, or some tennis elbow that we call it. So today it's Friday. We're going to do a little bit of dry needling to get her on our way for the weekend. Okay, so usually how I work with dry needling is I always wear gloves. I also sanitize my hands as well, extra precautions. I have had these on for a couple minutes now, so I just like to clean my hands. Next thing we'll do is, I try and get all my equipment ready as well. Take a cotton ball with a little bit of stanhexene, which is a type of solution just to disinfect the area. So we clean it off just like that. We want to make sure that any excess is wiped off as well. So I thought it'd be nice to Arifa. I'm not using anything too big. Okay, so we've looked at her muscles already. Already we found out we want to probably try and release her brachioradialis, which is a muscle that bends the elbow, and then that is involved in certain movements in the wrist as well. The other muscle that we want to work on is one of the extensors that attaches specifically on the radial side of her wrist there. Okay, so we found the muscles that we want to do. We're going to bracket, if you want to zoom in a little bit. And Arifa's going to let us know what she's feeling as well. So right there, we're going to come in. I'm going to try and move my hands. There's the initial poke. And then after that, there we go. I think I got a twitch there. How you doing, Arifa?
Good.
Yeah, good?
Not so bad so far.
Not so bad so far?
Slight twitch.
Okay. Okay, so what I'm doing is I'm just pistoning in the area, and then I want to give a little bit of TLC. So I'll rethread my needle. And then here I'm going to do the brachioradialis right here. So I come in, puncture my needle in.
Oh, there we go.
There we go. We got a twitch there. Okay. A little bit of TLC. No drops of blood or anything. It's really hard to see anything in the video there, but you get the gist of the idea. I'm going to come a little bit lower here. Okay. I want you to bring your wrist. Very good. Bring it back down.
Oh, there we go. Nice twitch.
Yeah, nice twitch there. Because I'm so nice, I'm going to
a few twitches.
Play a little bit more in the area. One point that I also like to do when it comes to tennis elbow is I'll come and do a acupuncture point. So we got an acupuncture point right here, which is large intestine 11. So what I'll do to find my point is I'll find the biceps tendon, I'll find the outer bone here, the lateral epicondyle. I'll go halfway, poke my needle, and then what I like to do here is I like to stim the area a little bit as well. That's all right?
Feels good.
Okay, perfect. Okay. When it comes to lateral epicondylitis, I don't necessarily just focus on here. Oftentimes with my clients, I will also release the brachialis muscle right in there. Okay, so part of the biceps that can refer down. I'll also get the tricep, and sometimes I'll also work on the neck around between C5, C7, T1, just because these are the nerve roots that innervate in this area here. So those are often points that I'll do, and sometimes I'll even connect a type of stim from here to this area right here to get that connection going. So that's a typical type of treatment that I'll do for lateral epicondylitis. If you do suffer from something like this, you've tried other therapies that maybe hasn't worked and you want to try something different, or this is your first time going through an injury like this, you'd like to come see us. If you have any questions, give us a call. Thank you.